Hi, my name is Ikhtiyar. He is my friend named Valijan. He came from Uzbekistan with diagnosis squamous carcinoma voice box. Dr. Ashish doing biopsy report showing correct diagnosis squamous carcinoma voice box. After report, he's taken radiotherapy 15 sections, but his voice like damage, not well. After 1 year, he came for recover voice. Doctor saying I take fat from your abdomen and put in voice box. Right now surgery is done. He is happy, but doctor saying avoid 2-3 days, no speak, no talk. After 3-4 days you can slowly start. He is happy. He is like Manipal Hospital. In Uzbekistan, this treatment is wrong. He is taken like 3 cycle chemotherapy, and biopsy also wrong, and cutting some voice box. After this, his voice is damaged. About Manipal, Manipal is a very good hospital. I like this hospital. All teams best doctor have, like Ashish Vashishth also is best doctor in oncology department, radiology department. All his doctor is best, like respect him.
Hi, this is Dr. Ashish Vashishth, ENT department, Manipal Hospital, Dwarka. This is a story of patient Valijan who came to us last year with a very bad voice. He was a reformed smoker, and on examination, when we did a laryngoscopy, we could see that he has a small growth on his vocal cord. Now that was duly biopsied, and it revealed a cancer of the vocal cord, which is called squamous cell cancer. Subsequently, we took him up for surgery that was completely endoscopic. We could remove the vocal cord cancer through lasers, and then subsequently also he underwent radiotherapy for tumor clearance. Now he's been fine. He's been on follow-up since 1 year, and there is no cancer recurrence anywhere in the body, which is quite good to know. But now his problem was that he has a bad voice. The bad voice is consequent to many things, which is basically the vocal cord cancer itself, the surgery, also the radiation therapy, which means 3 problems which cause a bad voice or a poor voice. Now in some patients, voice is a part of their profession. He is a wedding photographer, he is into journalism, and these patients, a bad voice can potentially destroy or alter your career. So in this situation, something has to be done to address his voice, and which for him, what we chose was a very minimally invasive procedure where we can take some fat from the body, the thigh or the abdomen, and put that fat, inject it with some other medications inside the rest of his vocal cord that is still there. And that leads to improvement in voice. While that may not bring an absolutely normal voice, but that definitely improves his voice. And this is just one more example to show how these patients often require hand-holding in long term, and treatment of their cancers, whether it is of the nose, the ear, or the voice box. Now all these are very important senses we have to be able to hear, to be able to speak, and to be able to breathe. Cancers of all these regions of the neck, of the throat, they strongly create problems in all these senses, which can alter your life despite treatment. So treating these vital kind of tumors here, whether they are cancerous or sometimes non-cancerous, tuberculosis for example, it needs a lot of extra efforts from the clinical team's time. It needs high-end equipment, it needs technical expertise, it needs a team. Like in this patient, we had the operative team, we had the team of oncology, which gave him radiation therapy, we had the pathology team, which could create a clear diagnosis, and now again we have come back to how to rehabilitate him. So when you are confronted with such a problem, you have been diagnosed, or it is suspected that you have any kind of lesion which could be a cancer, may not be a cancer of these regions, it is imperative that you go to the right clinical team, because treatment could be in multiple steps and it may take some time to reach your required destination. So we at Manipal Hospital provide that. It is the most advanced treatment that you can get anywhere in the world right now. So next time somebody in the community has these kind of problems, Please don't be scared, and there's someone to take care of it. Thank you.